I ate so many cookies after surgery.
Well, you look great.
Thanks.
So I'm going to have you go ahead and turn around. We're going to
Okay.
take a look at this scar, and then we'll also talk about how we're using the microcurrent to come in and address inflammation. And remember, in the presence of inflammation, the body cannot heal. You know, those cells are on fire, right?
So it's CRPS being inflammatory. It's always inflamed too.
Yes.
Right? Yeah.
And how did you tell me how often are you
Treating the scars?
yeah. No, well, and it's not really the scars, because once you treat the scars, you know, maybe 2 times. Just depends upon the depth of the scar. Hang on, I think I might have a little malfunction of my.
Uh-oh.
Yeah, there we go. Might be my cord. Give me just a moment. But how often?
I usually first of the month pay my bills and treat my scars.
Oh, okay.
And then I've gone in the circle on my stomach both ways. And then I've also just gone to like roughly where the liver might be and the things that I've had removed.
Okay.
So I know I have a lot of adhesions and scar tissue and stuff. So it's just get the whole stomach.
So what I'm looking at right now is the scarring, the inflammation levels. I've got 33, 44,
That upper to the left.
62.
Yeah, that's where it hurts. That always
Yeah.
bugs me there. It's really irritating.
I got 63 right here.
Okay.
So I'm actually just going to stay right here, and we're going to dose 0. And just that little bit of movement, I slid up just slightly. I'm at 82. And we have a double 4. So if you remember, that means that it's a block.
Okay.
That's an electrical block. Okay. Let me know when you feel the current.
There.
High, medium, or low?
It's low.
Okay, excellent.
I feel it in my legs. I always feel it in my legs before I feel it in the spot.
Mm-hmm.
So it increases the burning some. Now
So we got a dose. It took about 30 seconds.
Okay.
So think about this. Electrical should be lightning fast, right?
Mhm.
It took about 30 seconds for the electrical from this point to reach the brain, where the brain acknowledged this old injury.
Okay.
Okay. Now what it's doing is it's coming back down to the injured site. I'm on 2, which tells me kind of like it's got 2 more blocks to work through. And this biofeedback is letting me know how the tissue is responding to the treatment. Now I have, been on a dose 0. My longest time was a little over 20 minutes.
Wow.
Oh, there we go. You were pretty short. That was 1.5 minutes.
Okay.
So that was 82. Now it is still showing the block, but we got the brain's attention again.
Okay.
Okay. And now I'm going to come down 1.
I think a screw we used right above the scar.
So this one is registering 112.
Wow.
How does this feel? Can you feel it? And it is blocked.
Mhm.
Do you feel the current?
I feel it really strong in my legs, like to the point where it feels like my legs are going to give up.
Okay, well, grab that chair if you need to.
Okay.
So what it's doing, it's following, your electrical. And it is moving. It was, it's toggling back and forth between being blocked and not blocked, which is kind of exciting.
Yeah,
If we can just get a little breakthrough. You're feeling it? There we go. So now we'll go to that next point. All right, this is 134. What was that last one? 112? And it's not picking up an electrical signal right here. So whenever you're doing this, do you ever use the mineral gel?
Sometimes.
The Spectra gel? Okay.
Only that's just if I'm. No, is that the one to help Not
to
the one
conduct.
that helps. Okay, no. I just use the ones to keep the pads on.
Yeah. So what's happening right here is it's not picking up an electrical signal.
Okay.
Okay, so we'll do this a couple times. If you have the mineral gel, let's just watch and see what minerals do. I just put a little bit on the ball, and I'm going to turn this down because it's likely to be too high. How's that?
That's fine.
Not too high?
No, it's okay.
Okay.
I feel it really strong in my legs and feet.
So what's happening right now, did you kind of feel it open up?
Mm-mm.
Did you feel it get a little higher?
No, I'm trying to picture like a flowing river while you do it.
I love it. I
Like
love
to
it.
help
Oh, it didn't catch it. Or I may have moved, but no, it's not catching something.
Okay.
All right. So when that happens, if you cannot get it, we're going to move down to a different setting. And this one's called RSI, fMRSI. Do you feel that?
Yeah, slightly.
Okay, I'm going to power up just a little bit. This one actually, I think it's Vanguard out of Texas and Stanford are both studying the increased blood flow and microcirculation to the tissue when using this setting. All right, I'm not getting anything here. So now what I'm going to try to do is see if I can't move something towards. Do you feel that?
Mm-hmm.
Feel the current?
No, I just feel you doing it.
And you got some sticky back here. Just a reminder, sticky and no sound is an indication of an affected area. Okay.
Mm.
Now let's go back and we'll try this, see if we got a change. And sometimes this part right here can take quite a while.
Especially when you've had a whole bunch of surgeries.
And yes, yep. So again, I am still getting 0. It's not picking up any electrical.
Okay.
When was the last time anything, was your back was worked on with the wand?
I was trying to do it a couple days ago because my neck's kind of out of spot.
What about down here?
Just the hips.
Okay.
I didn't work. I did the scars at the beginning of the month.
All right. Give me a second.
And it was mostly my hips that were sticky versus the shoulder when I did that.
Okay. Well, just for the purpose of the video, I'm going to move down and I'll come back to that area.
Okay.
Okay. Here we've got a 113. We also have a block.
These are way up since the class then.
Well, and I am using the mineral gel. Remember, so that will, it's not skewing, but because we're using it as a conductor. Okay, water is also a conductor. If you don't have this,
okay,
you can also use a little bit of salt water.
Okay, that makes more. I've read about people using water, and I was like, I don't think we do that with this one, but
yeah.
Okay.
If you don't have these other, if you don't have a little bit of mineral gel,
okay,
you can certainly just a little bit of literally just a couple drops of water with a good quality salt, not Morton's.
okay.
Okay.
No, I have sea salt, I think.
Yeah. Do you feel the current?
No.
Okay. But you felt it when
I
I was
do
on.
now.
Did you feel it when I was on the back?
On the scar, yeah.
Right here, you feel it?
Yeah.
Okay, good.
Correct.
Yep, we're not getting anything. All right, so I'm going to finish doing this and then we'll come back. Yeah, see all that drag?
Yeah.
Yeah, there's
Super
quite a bit
sticky.
of inflammation.
Okay.